Hello.
Yes,
Okay.
we can hear you.
All right. So let me share my screen. So is everyone able to see my screen?
Yes.
Okay. So welcome everyone to this session. As Katile has just said, my name is Connie Kaimenyi and I'm a BBYI member. And our topic today is HIV and AIDS in sexual reproductive health. This is for this particular fellowship that we have, that is on Comprehensive Sexual Education Champions Fellowship. So, who is Connie Kaimenyi? I'm a PHO, and my slogan is always building healthier communities together. Like I have said earlier on, I'm a public health specialist, BBYI, SRH advocate. I'm also a youth mentor and the founder of Koshka Consultancy, Kenya. So for our training today, our objectives are as follows. Number one, I would like to increase an understanding of the prevalence of HIV and the drivers of HIV and AIDS. Number two, I would like to improve understanding of the risk factors of HIV acquisition. Then number three, also we shall improve understanding of HIV prevention and treatment approaches. And number four, I would like to develop participant skills and capacities to lead trainings on HIV and AIDS in SRH. So what is HIV? In layman's language, I'm very sure most of us have an understanding of what HIV is. But getting into details, HIV number one is a virus, and it's a virus that affects human body. And what does it do? It mainly targets the immune system called the CD4 cells. The CD4 cells are cells mainly located in the white blood cells, and these are the cells that help the body respond to infections. So within the CD4 cells, HIV replicates and in turn damages and destroys the cells. So without effective treatment of a combination of ARV drugs, the immune system will become weakened to the point that it will no longer fight infections and diseases. Can you hear me? Are you people getting me clearly?
Yes.
Katile? Okay. All right. So in summary, HIV, or rather human immunodeficiency virus, attacks cells that help the body fight infections, making a person more vulnerable to other infections and diseases. It is spread through contact with the bodily fluids of a HIV positive person, such as through sex or sharing injection drug equipment. And if left untreated, HIV can lead to AIDS, which is the late stage of HIV infections that occur when the body's immune system is badly damaged because of the virus. currently there is no effective cure for HIV, but with proper medical care, it can be controlled. And we'll be getting to how we can actually control the virus to maintainable standards. So we are being told that apparently HIV remains a major global public health issue, and having claimed an estimated of around 42.3 million lives to date. So we can actually see it's actually a point of concern. So apparently we have over 39 million people have actually been infected with the virus. Get back to my slide a little bit. So over 36 million adults and children are living with HIV, with over 1 million deaths per year. That is according to statistics from the World Health Organization in 2015. So we're just getting the history of HIV. So we can see Africa actually has the highest burden of HIV, and also the other parts of the continent. But we can see it's a real issue in our continent. So currently, in 2023, we can see the numbers also on the as you can see on the screen. Africa, this East and South Africa, we have for 50,000. That is the burden of HIV. This is the estimated number of adults and children newly infected with HIV, according to 2023. So we can see Africa, we still have an issue, and various other continents, Eastern Europe, 140,000, Northern America, Latin America, Asia. But you can see where we are as Kenyans, that is Africa, our continent, for 50, which is still burdensome. Getting to the history as well, we can see the progression of HIV virus. The number of people living with HIV on ART, that is antiretroviral therapy, globally since 2010 to 2017, has been increasing onwards. This is up to 2017. You can see this was 21.7 million, which is also a huge number. So currently, that is in 2023, the global burden of HIV, we have 39.9 million people living with HIV. This is an increase by 25% since 2010. As we can see, we have 1.3 million people have been newly infected. That is in 2023. This is a 39% decline since 2010. As we have seen in the onset, 2010, this was we had 7.5 million, and it went increasing on and on. But we can see the new infections are actually decreasing in number, in percentage of new infections per year relative to 2010. So on the deaths from HIV and AIDS, we have 0.6 million deaths in 2023. That is a decline decline in percentage of death relative to 2010. So on to our next slide. We want to look at the prevalence in Kenya. So in Kenya, HIV prevalence rate is at 3.3%. But we can also look at the prevalence rate based on the age and various factors that actually influence HIV. So HIV prevalence in Kenya, we have around 2,075,691 people were living with HIV and AIDS in 2024. That is last year, that is according to research. And then we have 3,000 350 new infections in 2024 as well. We have 4,000 deaths in 2024. And we have 18.7% of people who inject drugs in Kenya are HIV positive. So these are the group of people who normally use drug. We call them DUP, people who inject drugs. We shall be looking into that as we go on. So HIV by age group, we have 38% of new infections in adults are among people aged 15 to 24 years old. So we can see the youths. It's the youths who are mainly at the risk of this particular virus. And most importantly, we have adolescent girls are 4 times more likely to be infected than boys. This is also due to various biological factors that actually put the girls at a huger risk. We shall also be discussing that as we go on. So HIV prevalence is higher among young women than young men. That is also a biological factor, whereby, according to research, they have concluded that women actually are at a more risk of getting infected by this particular virus than the boys due to various biological factors, or rather how the female genital parts are different, or rather they differ from the male genital parts. We shall be discussing that. So HIV in Kenya by population, female sex workers, men who have sex with men, people who inject drugs are disproportionately affected. This is the major group that is affected in Kenya, and also most probably in the whole world. Yeah, so female, these are the female who also inject drugs, have the highest incidence. Again, female. All right. So in by county, we have Kisumu, Migori, Homa Bay, Siaya, Mombasa, Nakuru. In that order, they have high burdens of HIV. So in Kenya, we are still making various significant steps in responding to HIV. And apparently, we have a 68% reduction in HIV-related deaths since 2013. So we are seeing the deaths are actually reducing. This is due to various interventions that have been brought up in Kenya to actually reduce the adverse effects of the virus. So moving on swiftly, we have seen that this is the current burden of HIV county-wise, and as we can see from the statistics, we can see we have Migori at 10.4%, Nairobi, we have Mombasa. These are the counties where we have actually high HIV rates. Siaya mentioned, and this is how HIV is actually spread. And you can see the western part of the country is where we have most HIV incidents, and according to the map as shown below. So let's move on. So I would like to engage you guys and pose just a question. What are the risk factors for HIV acquisition? I think I've mentioned a few as I have been discussing above, but I'd like to have you engaging, and somebody can type in the comment section, or you can actually unmute yourself and tell me which, or rather what factors are those. Somebody can tell us. So I can see Vera. Vera is saying unprotected sex. Yes, we have unfaithfulness. True. We have Mutembei saying healthcare workers due to hospital injuries. That's true. And then we have multiple partners from Vera as well. Any other person? Risk factors? Yes, from the comment section. Due to road accidents, Mutembei is saying so. We have Anelka saying unfaithful partners, unprotected sex, yes and yes. So we have Vera unprotected sex by sex workers. We have mother to unborn children from Vera. Eddie is saying anal sex by men having sex with men. And then we have Irene is saying gender, that is women are at a higher risk. That's true. So I'll move on with my slide shortly. Vera is saying sharing syringes. Very true. Eddie Osire is saying most women wanaletewa ugonjwa kwa nyumba. Wow, that's true as well because we have very many incidents of men being unfaithful. And a very important factor as well, whereby we've seen that women are actually at more risk of getting infected by these virus due to actually genetical makeup, or rather the physical genetical makeup of the female, whereby we have female have more exposed membrane. So moving on swiftly, I'm gonna be sharing my screen again. So I don't know whether you guys can hear me. Katile.
Yes.
Okay, let me proceed. I want to reshare my screen. Allow me to reshare the screen again. My internet has actually.
I've put you as a cost again.
Okay, all right. So so what are the risk factors of HIV acquisition? We've actually discussed about that in the chat box. John Otieno is saying campus lifestyle, mostly sherehe time, etc. Those are all relevant and valid points. So risk factors for HIV acquisition, they are categorized into two groups. That is behavioral factors and biological factors. So on the behavioral factors, we have anal sex, that is men who have sex with men, MSM. That is one of the major risk factors for acquisition of HIV. So number two, we have multiple or overlapping partnerships. And with partnerships, I'm speaking about sexual partners. And number three, we have genital inflammation through douching. So douching, anyone who knows what douching is, you can actually unmute yourself and tell us what douching is. Swiftly, I'm going to give you 2 minutes. Is anyone aware of douching? Anyone? Okay. All right. So douching is actually cleaning the female genital parts with various detergents or various chemicals, whereby you have, maybe you engage in a sexual activity and you want to clean up your vagina using various detergents or soaps. So you might find yourself scrubbing a lot, and you might actually cause inflammation on your genital parts. And this is mainly for females. So that is a risk factor for HIV acquisition. And then number three, we have rape. We all know rape causes various ulcerations, that is tearing of the genital parts. And then we have early sex debut. This is whereby you might find someone starting engaging in sexual activities at a very early age. And that is also a risk factor of acquiring HIV. And it's actually on the part of behavior. But the other categorization of the risk factors, we have STIs. When someone is actually infected with STI, they increase the infectivity of HIV infection. When when you have an STI in your body, let's say syphilis, gonorrhea, your infectivity to HIV is actually increased. So that's why we are always encouraged, if you have an STI in your body system, kindly do go for checkup and get treatment as soon as possible, because you're putting your health at risk. So the other biological factor, we have viral load. When an HIV person has a high viral load, they are at a high rate of transmitting this particular virus to their partners or to other people. That is another biological risk factor. Another biological risk factor is non-circumcised men. Men who are not circumcised are at a high risk of transmitting and even getting infected with HIV. We shall be tackling that in our next slides on how actually circumcision affects HIV acquisition. Then the other factor is pregnancy. And pregnancy in itself, when someone is pregnant, the immune system is actually altered. And this is where you find now your immune system is actually lower than normal levels. And that's why you're also at a higher risk of getting a transmission of the HIV virus. So who are at risk of acquiring HIV? I think I've mentioned some of the people who are at risk of acquiring HIV, but I'd like to hear from the team, the people, the major groups that are mainly affected, or rather at a high risk. Someone can type in the comment section, or you can actually lift your hand and tell us. In the comment section, which groups are mainly at risk? Yeah, Eddie is saying sex workers. True, that is true. Commercial sex workers. From Irene. Manu Emmanuel is saying GSM. Tatila is saying gay persons. Very true. Minor Eric is saying adolescents. True. The youth, the young people. Anelka is saying youths addicted to drugs. Very true. Manu is saying AGYW. I think he's meaning the gay people. And then we have Edith is saying long distance truck drivers. That is true due to the kind of job setup that they are in. Victorine is saying people who inject drugs. That is true. So Emmanuel is saying adolescent girls and young women. Oh yeah. I've really gotten your abbreviation right now. So my internet is actually unstable. I don't know. No, I'm trying to reshare the screen. So you guys, can you hear me? Katile, can you get me?
Yes, I can hear you.
Okay, so my screen is actually getting stubborn. Emmanuel is saying discordant couples are also at risk. That's very true. Mhm. So I'm gonna proceed with the slides. Let me try again. Mhm. So my internet is so stubborn. I'll reshare with my phone. Sorry for this. So my screen is really not cooperating, but let me check. Oh, mm, yeah. Katila is saying I share the handout. Let me share it with her. Sorry guys for the technical hitches, but I really don't know why my laptop is playing games with me right now. But let me share the slide.
Hello, Connie. I think you can continue as you try to share with me so that we don't leave people hanging.
All right. Yeah, I was thinking about who are at risk of acquiring HIV, and people have made several responses, which I totally agree with. And actually, the most groups that are most at risk, the key populations that are most at risk for acquiring HIV are the sex workers and their clients. Most of you have forgotten that. It is the sex workers together with their clients. So if you're a client of the sex workers, your risk ratio is actually proportional to the sex worker herself, him or herself. And then the other group is men who have sex with men. That one you're all aware of that. So that is another group that is most at risk of HIV. And then we have people who use drugs, PUD. Those are the three major groups of people that are at most risk of HIV. Then the other group that is other groups that are most at risk of HIV are actually the transgender women. Transgender women are most at risk of acquiring HIV. That is also because of the genetic factors or the genetic makeup of their body. So I'm also trying to share the slides. Then the other group is the prisoners or incarcerated people. Prisoners are also most at risk of acquiring HIV due to the environmental setup of their location. So as we move on, the other thing that we shall be looking at is how HIV is transmitted. I would really like that to be shared on the screen. I don't know why my internet is... So Katila, I've shared with you the document. I don't know whether you've gotten it.
Not yet, but when I get it, I'll share.
Guys, I'm so sorry for that, but my internet is actually so unstable. So I'll proceed. I'm looking at the question. Vera is asking, what makes anal sex more susceptible to spreading HIV than normal sex? That is a very good question, Vera. So when it comes to normal sex, we are all aware of the dynamics of sex. whereby when you're having intercourse with a female, they are required to actually get wet, and that is what actually lubricates the entire sex, or rather intercourse activity, or rather in event. So on the other side, with men, when it comes to men who have sex with men, the lubrication is not there. And when you have no lubrication during that particular intercourse, you will find the internal, or rather the lining, will get teared. And with HIV, or rather the virus, it is prone to getting transmitted through ulcerations, or rather those tears on the skin or on various body membranes. So that is why actually men who have sex with men are the number one category of group that is at most risk of transmitting and of acquiring the virus. So guys, I've been really trying to reconnect my internet, but it's so stubborn. Actually, the lights on my side are not there. That's why I had to buy some bundles. That's why they are really disturbing. But I can see it's still sending. Katilia, I've shared it on WhatsApp, but it's having trouble coming on your end. So I'll proceed. I think I'll share the notes later. So how is HIV transmitted? HIV is transmitted through certain body fluids. That is semen, blood, we have rectal fluids, we have vaginal fluids, and we have breast milk. Those are the various categories of fluids that actually enhance the transmission of HIV from an infected person to an uninfected person. So these fluids must come into contact with a mucous membrane or a damaged tissue to be directly injected into the bloodstream for transmission to occur. So there must be a direct route whereby if it's semen, it must come directly from the infected person to the non-infected person. If it's blood, the same. Rectal fluids, the same. These are fluids from the rectum and what have you. And then we have the vaginal fluids as well, and breast milk. We shall get into that as we proceed. So various parts of the body that have mucous membranes includes the mouth, the rectum, the penile or the penis, and the vagina. So these are the regions of the body where we have the mucous membrane. And as noted earlier on, the rectum has a mucous membrane, but we've seen that rectum is prone to tearing, especially during sex between two men, because there is no that aspect of lubrication. I hope you all get me. So that is why you find that particular part of the body getting tears. And with tears now, we have semen is a fluid that can transmit HIV. So once this particular semen penetrates through the pairs in the rectum, you'll find this particular man being very susceptible to the HIV virus. And then on the aspect of blood, we really understand blood. When blood is infected with the virus and it gets into contact with a person who is not infected and they have actually an wound, they will be definitely infected. Then vaginal fluid is also self-explanatory, mainly through sexual intercourse. And then breast milk, this is whereby we have the mother to child transmission. Breast milk also has a potential of transmitting HIV virus. And we'll actually get into how we can actually regulate the transmission of HIV from the mother to the child. This is whereby the mother now is required to reduce their viral load to levels whereby they can actually reduce the transmission rate to the child. So moving on swiftly, I wish I could actually share the slides for better understanding, but it's all right. I'm gonna proceed. So the modes of transmitting HIV, we have unprotected vaginal or anal sex, and in rare cases, oral sex with a person living with HIV is also a mode of transmission. We have blood transfusion. We've gone in the aspect of blood. We have sharing of needles and syringes. We have from a mother living with HIV to her infant during pregnancy, childbirth, or breastfeeding. Those events are when the virus is actually most at most risk of being transmitted. So ways HIV is not transmitted. HIV cannot be transmitted through tears. Again, HIV cannot be transmitted through saliva. Another way that HIV cannot be transmitted is through mosquito bites or ticks or other insects. HIV can also not be transmitted through sweat. It cannot be transmitted through sharing of dishes, through shaking of hands, sharing of toilet seats. Will not get HIV. Through the air, it's not transmitted, and through hugging, it's not transmitted. So these are you need to also know ways that HIV cannot be transmitted. It is basically to reduce the stigma associated with people living with HIV. You can say hi to them, you can greet them, you can do all those things, but what you should just avoid is making your blood interacting with their blood. Maybe you can avoid intercourse and things like that. So we should also learn to actually accommodate people living with HIV, but those precautions. So without treatment, how quickly can a person living with HIV become ill? So it is another area that many people are not aware of. So I don't know whether are we together, guys? Are you following? Or am I speaking to myself? Katile, can you get me?
Yes, we can. Okay, yes, I can.
You
Yeah,
can.
I'm
Okay,
also
Vera.
getting really.
Okay, thank you for that. I'm really sorry for the technical issues, but I'm really trying to share the slides. But my internet is actually working on my phone, but when I connect it with my laptop, it's not cooperating. But maybe you can, let me see whether it's, give me a few seconds. Give me a few seconds to try and see whether I can get it transferred through the cable. Katile, are you there?
Yes.
Okay, thank you. I'm resharing it again. Okay. It has disappeared. Okay.
Connie,
Yes, Katila?
you have joined with one device. I don't think you've joined with a laptop.
Yeah, I've joined with both. I had joined with both, but the laptop now connection disappeared. And that's where my document is. And I'm trying to share it to the phone WhatsApp. That is where the problem is coming. Let me transfer it once again. Give me 1 minute. I try to transfer with the cable, with the USB. So
Hello. Let's wait for Connie, the speaker, to rejoin. Meanwhile, if you have a question, you can use the chat box so that we can discuss the question as she comes back. Can use the chat box, can raise questions.
We need the form. We need the form to register.
Yeah, I will be sharing now. Don't worry about that. So you can use questions. I'll be sharing the attendance form in the chat box. So kindly look at it. Msicomplain amjapata. I'm sharing it now. I can see Connie, you are back.
oh, sorry for that. Yes, I'm here.
Okay.
I've actually successfully shared the slides with you. I don't know whether
Okay.
you them.
Let me see. I've seen them.
Okay.
Okay.
So what are you suggesting?
I was waiting for you to rejoin.
Yes.
I think you can continue as I try resharing.
Yes. Okay, that will be nice. I'm on slide number 18. You can click on slide number 17. 17. Yeah, number 18, number 17, yeah. So I was talking about ways HIV is not transmitted. How is HIV transmitted? I think we've looked at that. How HIV is transmitted, it's through semen and what have you. How HIV is not transmitted, we've also looked at those areas, that is saliva, sweat, etc. So without treatment, how quickly can a person living with HIV become ill? We are informed that people living with HIV are not diagnosed or are not on ART, that is antiretroviral therapy. Signs of HIV-related illness may develop within 5 to 10 years. For some, it can be sooner than that. So the time between HIV transmission and diagnosis of AIDS is usually 10 to 15 years, but sometimes it can be longer. That is why research has proven that HIV has a very long latency, and that is why actually we have been unable to develop a proper vaccine to actually deal with HIV for good. And that is the main factor, the long latency of this particular virus between the infection period and the onset of the signs and symptoms may take up to 10 to 15 years, which is quite dangerous because you might be actually transmitting the virus without your knowledge. So there is a very small number of people who have managed to control the HIV infection without antiretroviral virus, and this is called the elite controllers. And this is not for everybody. An elite controller is defined as a person living with the HIV who is able to maintain undetectable viral loads for at least 12 months, despite not having started antiretroviral therapy. This situation is very rare, and most people will need ART to avoid becoming ill. And becoming ill is now whereby HIV actually graduates to AIDS. And we know that once HIV becomes AIDS now, you're at greater risk. So moving on to the next slide, how is HIV treated? So HIV, I'm going to look at how HIV is treated first, and then we shall be looking deep into how HIV is prevented. And that is actually where my main focus will be, on the prevention interventions for the HIV. So HIV basically has no cure, but it can be treated using antiretroviral therapy. This particular therapy is mainly a combination of HIV medicines that treat HIV infection, whereby several drugs are combined together to come up with a therapy that can actually reduce the adverse effects of the virus. And examples of the drugs that are combined, we have the Kelatra, Epizone, Truvada, Atripla, and what have you. So antiretroviral therapy drugs, they work by suppressing or stopping the replication of HIV virus, whereby the virus is not multiplying in number. So that is the essence of this particular therapy. It also reduces the amount of HIV in the blood. It improves the immune system function. It slows or stops HIV symptoms. It also does prevent HIV transmission. We shall know how actually the ART can actually prevent HIV transmission. I'll be shedding some light on that as we proceed. So the benefits of ART, it helps people living with HIV live long, healthy lives, and it reduces the risk of HIV transmission to other people. And then ART can turn HIV from fetal infection to a manageable chronic condition. That is why we encourage people to go for testing. Once you are tested, you start the treatment as early as possible, because the treatment actually has a lot of benefits, whereby once you start taking this particular therapy, the viral load will be reduced. This is due to the ability of ART to suppress the replication of the virus. Onto the next slide. So how ART is taken? ART is taken every day as a pill. If you choose the option of pills, you're gonna take it every day. We have the option of once a month through an injection, or even every 2 months, after every 2 months. So we can see that actually we have options of the pill and injection. So ART regimen can include single tablet regimen, multiple tablet regimen, compact product, oral suspensions, or injectable product. ART for pregnant women. So we are saying that ART is recommended for all pregnant women with HIV because it reduces the risk of HIV transmission from the mother to the baby. We know that there is a possible risk of transmitting HIV from the mother to the baby through that we call it whereby the mother transmits the virus to the baby. So the main goal of HIV transmission treatment is to reduce a person's viral load to undetectable levels. That is the main goal of ART. Once you start taking ART, your viral load will be reduced, and we shall get to see the benefits of reduced viral load as we proceed. So ART can reduce the level of virus to such low levels in the body. This gives the immune system a chance to recover and produce more CD4 cells. In the beginning, we say that HIV is a virus that targets the CD4 cells, and this CD4 cells is the cell that is meant to protect the body against various infections. Therefore, a person living with HIV can enjoy good health provided they adhere to treatment and treatment remains effective. On to the next slide. So once you start taking the ART, we have a level, you will attain a level that we call U is equal to U. Undetectable is equal to untransmissible. So what do we mean by undetectable? So we have durably undetectable is whereby you have 2 consecutive viral loads results presenting as less than 50 copies of the virus per millimeters of blood. So once you start taking ART, you'll achieve a level that we call undetectable. And how do you know the viral load has attained undetectable levels? That is whereby you go for testing, and probably the healthcare provider tells you you've actually achieved undetectable levels, whereby the count is less than 50 copies. Then untransmissible, this is whereby once you have achieved the undetectable levels, it means you can also not transmit the virus to the next person, which is a very good aspect of taking the ART medication. That is why we encourage people to adhere to strict taking of the medication so that you achieve this particular undetectable and transmissible level. So antiretroviral therapy adherence resulting to durable virus suppression eliminate risk of sexual transmission of HIV. So adoption of UU campaign, U is equal to U campaign, is poised to revolutionize HIV transmission among people living with HIV and fortify treatment for prevention strategies. So as we have seen that once you have less than 50 copies of HIV virus per millimeters of blood, you eliminate the risk of transmitting HIV through sexual intercourse. Get me right, this particular undetectable and transmissible only applies through the mode of transmission of sexual intercourse. And we all know that HIV can be transmitted through even other means of whereby when you get into contact with infected blood, various injectables and what have you. But this particular undetectable and transmissible applies to transmission via sexual intercourse, and mainly the normal sexual activity that is between a man and a woman. So U is equal to U offers a unique opportunity to eliminate stigma and discrimination. It also emphasizes the importance of ART therapy and daily adherence and continuous engagement in medical care for people living with HIV. So this is the kind of messages that you need to be spreading out there. As a SRH trainer, once you get a group of people that needs to be enlightened on HIV matters, you need to encourage them to actually adhere to the ART remedy. And these are the kind of benefits that they'll be getting, whereby they'll achieve undetectable and transmissible level, whereby they can actually live their normal lives to levels whereby they will not be prone to transmitting the virus to the next person through the sexual intercourse. So on to the next slide. Benefits of undetectable and transmissible. It will actually reduce stigma associated with living with HIV. It reduces barriers to HIV testing and treatment, whereby now if people can actually see the benefits of taking ART, they will actually be encouraged to go for the treatment. Because actually, formerly people didn't understand, why should I take these medications, yet in the long run, I'm gonna die. But now we have an understanding that once you adhere to this particular ART remedy, you can actually reduce the viral load, which is very encouraging. So it also increases interest in starting and staying on ART. It improves self-esteem by removing the fear of being contagious. It supports a healthy sexuality regardless of HIV status, and it also reduces sex partner concerns. So once you're infected with HIV, it doesn't hinder you from a relationship with another person and having a healthy sexual lifestyle. We shall also look at various other methods of actually reducing the transmission of the disease. So on to our next slide. Important message to patients on undetectable and transmissible. You should be telling this particular individual, keeping your HIV undetectable helps you live a longer life. We have mentioned that earlier. To get HIV to undetectable levels and keep it to undetectable, take ARV medications as prescribed. Not better, as prescribed. Once you start the medication, always ensure if it's the pill and you're supposed to take it on a daily basis, ensure that they take it on a daily basis. If it's an injection that is supposed to be taken once a month, ensure you go for the injection once a month. So it may take up to 6 months of taking HIV treatment medication to bring your HIV viral load down to undetectable levels. So once you start taking ARVs, don't think that your viral load has immediately gone down. No, you need to take the medication as prescribed for around 6 good months for you to attain the UU level. If you're durably suppressed and you're taking your medication as prescribed, you can be sure you'll not pass HIV through sex. So people who keep their HIV at undetectable levels will not pass HIV to others via sex. If you stop taking HIV medication, your HIV can rebound to detectable levels within 1 to 2 weeks. That is how it is. Once you start taking medication, you need to follow the routine progressively, because if you alter it, the viral load will actually rebound to transmissible levels. So you need to keep your HIV at durably suppressed levels, and these will help you to safely conceive a child with your partner. That is another important aspect of undetectable and transmissible levels that are attained through proper ART medication follow-up. So on to the next slide. We have application of undetectable and transmissible in other settings, whereby, for instance, when breastfeeding, research have shown that ART has greatly reduced the risk of transmission of HIV through breast milk. So this is another aspect whereby ART remedy is very important, whereby once you start taking your ART medication as prescribed, you can actually be able to breastfeed your child without the risk of transmitting the virus. However, research has not established that people whose HIV is undetectable do not transmit the virus during breastfeeding. So it is not a full aspect whereby the virus will not be transmitted, but it actually reduces the risk. So that's why you're encouraged that if the child is exposed to the milk, they can actually take prophylaxis during breastfeeding. As they proceed with the breastfeeding, there is a certain prophylaxis that they are given. So that's why if you're infected with the virus, you always need to ensure that your healthcare provider is aware of that, so that they can always provide you with the necessary prophylaxis to give to the child, and as well that you can also as well take. So injection drug use. Studies demonstrate that ART greatly reduces the risk of transmission through sharing of injection drug use. However, it is not complete. It is not complete that the transmission will not occur through injection. So the only way that you can be sure of the reduction of the transmission of the HIV once you attain the undetectable and transmissible levels is via the sexual intercourse. So all people who inject drugs should only use their own needles and not share. So needle stick injuries. Research has not established that people with undetectable viral load do not transmit HIV to people who are stuck by needles containing their blood. So HIV PEP, that is the post-exposure prophylaxis, should be taken as per the guidelines. We shall also be looking at this particular prophylaxis as we proceed, the PEP and the PrEP. This is an area that I'm very much aware of, that most people don't have much knowledge about. So we can go on to the next slide. So what are the HIV prevention interventions? So because of time, I will actually go very swiftly. HIV prevention interventions. I don't know, I can give you 1 minute for someone to respond in the chat box, or you can speak out. What are the HIV prevention interventions? Just to make sure that you guys are following. So anyone, Katile, can you get me?
Yes. I think
Okay.
someone is answering the chat box.
Okay.
Emmanuel is saying PrEP, condoms, VMC. I think that is the male. I don't remember what, but something to do with the male, yeah.
Yeah, sure. We can go to the next slide swiftly. So HIV prevention interventions, we have various methods, and you as a trainer, you need to provide tailored prevention services and encourage people to do HIV testing and counseling. We have another intervention whereby we have treatment as prevention. We have seen that once you start this particular ART, you are actually preventing the transmission. Once you attain the U is equal to U, you can actually reduce transmission. So that's why treatment is used also as prevention. We have medical male circumcision is also an intervention. STI treatment. In our beginning, we say that STI is a risk factor for getting infected and for also transmitting the HIV. So you can always get treated with your STIs. You're also reducing the risk of getting infected with the HIV. Microbicides, that is also another biological aspect of reducing HIV transmission. We have treatment, prevention of drug or alcohol abuse. We know that alcohol abuse alters your way of thinking and judgment, and that's why you might find yourself into behaviors that pose a threat to the infection of the virus. We have education, that is behavior modification. We have condom use, we have blood supply screening, and then we have ARVs for mothers to prevent mother-to-child transmission. We have the PEP, that is post-exposure prophylaxis, and we have the pre-exposure prophylaxis. On to the next slide. So pre-exposure prophylaxis. PrEP is a safe and effective daily pill that prevents HIV infection. So who needs to take PrEP? The partner without HIV may decide to take PrEP if they are unsure that their partner's viral load is undetectable, especially if their partner has only recently started ART. So we've learned that ART can help you get to undetectable is equal to untransmissible levels after after 6 months of taking the drug. So if your partner has just begun, you can opt to use the pre-exposure prophylaxis. If you have more than one sexual partner, whom you don't know their sexual status, you can also use PrEP. If you feel more secure with the added perception of protection provided by PrEP, also go for the PrEP. Then we have the post-exposure prophylaxis. After a possible HIV exposure, you need to always go to your healthcare provider and get a medication we call the post-exposure prophylaxis. Then the other intervention is condom use. So condom is something that we all know, and it's actually a method that can also prevent the transmission of STIs and also prevent unplanned pregnancies. So condom use, we have various types of condoms. We have the external condom, that is for the males, and the internal condoms, that is for females. I'm sure that all of us are aware of how these particular condoms are used. And we are told that condoms, if properly used or perfectly used, they can provide 98% protection against STIs and against unplanned pregnancies. So apparently we have those main methods, that is the PEP, the PrEP, and the condom use. So on the other aspect, we have the pre-exposure prophylaxis. The people who are eligible to the PrEP use, first of all, we have the daily oral PrEP and the event-driven PrEP, which we shall also look at the notes. I'm sure Katila will share the notes with you all. So the people who are eligible for the PrEP is one who has been confirmed to be HIV negative through rapid antibody testing following the HTS services algorithm. So one must be willing to take the PrEP as prescribed. That is another eligibility criteria. One does not have a current or recent illness, and one has no contraindication to use the ARVs as recommended for PrEP, and one has to have no renal or liver disease. So that is it. On to the next slide. The types of pre-exposure prophylaxis against HIV. We have the pills, we have injections, and we have the vaginal ring. So we have the various types of pre-exposure prophylaxis. As I have said, we have the pill, we have the injection, and then we have the vaginal ring. So it's upon an individual to choose what kind of option that they prefer as PrEP. I'm talking about the pre-exposure. If it's the pill, we have the daily pill. And if it's an injection, you can go for either one injection in a month or so. And if it's the vaginal ring, which is something that also most of you are not aware of. So I'm gonna be tackling the vaginal ring. For the vaginal ring, sometimes it's called the PrEP ring or the DAPI ring. So this is a flexible silicone ring that is placed in the vagina and releases the ARV drugs, dapivirine, over the course of the month. So the ring is available in as an alternative to taking tablets for women who are unable to take daily PrEP tablets. So vaginal rings, which provide contraceptions, are also available, but the dapivirine vaginal ring is not a contraceptive. So this particular ring is basically to reduce the infection of HIV. So it's basically used as a PrEP. However, research is underway to develop a vaginal ring that includes both contraception and HIV prevention. It's recommended for those assigned female at birth. So if you're a male, the vaginal ring is not for you. So it takes 24 hours to be effective, hence ensure additional usage of HIV prevention methods such as the condom. So on to the next slide, we have contraindication, hypersensitivity to active substances, use in women with a non-positive HIV status, oral hormonal contraceptive. Due to its low systemic concentration, it's expected that dapivirine will not interfere with the efficiency and safety of co-administered oral hormonal contraceptive. So when it comes to use with condoms, it can be used with condoms, and both should be used during vaginal sexual intercourse. So we've seen that you can actually combine two methods to reduce the HIV prevention. You can go for the vaginal ring and at the same time use the condom. You can also use the pill as a PrEP and also use the condom. That's why you'll be having now double protection. And these are the kind of messages you need to be telling people who are prone to the HIV infection as a trainer out there. So on to the next slide. The daily oral PrEP, it is taken once on a daily basis. The first prescription is usually for 30 days to allow for the first follow-up visit, during which a repeat HIV test is conducted. Adherence, tolerability, and adverse effects are also assessed. So when it comes to the oral PrEP, it should be taken daily, and it takes 7 doses of continuous PrEP use to achieve adequate levels of the ARV in tissues for it to be effective. So if you're going for the PrEP option, you need to avoid dangerous sexual intercourse for around 7 days. So if you're going to be, if you know you'll be exposed, you need to take the PrEP for 1 week earlier before the exposure event. So that is it. So once you decide to go for the PrEP option, always ensure that you will only be exposed to the intercourse before 7 days. And this is mainly for the females. For females, if you want to avoid contracting the virus, take the PrEP 7 days earlier. But for males, it's a bit different, but you'll be advised as well to wait for around 7 days or so. But for those born male, can have protective levels as soon as 2 hours before sex, but ideally 24 hours. This is true even for people intending to take daily oral PrEP for ongoing exposures. So they're just saying that for males, if you take the PrEP around 24 hours earlier before the exposure event, you are also protected. You'll actually go through the notes and you'll get a deeper understanding of that. So this is the kind of messages that you need to inform people, that you don't need to go and have unprotected sex without a safety mechanism. So encourage them to actually use the PrEP medication as well as the condom use. If they don't want to use condom, they can go for the PrEP option. And on to the next slide. So an event refers to a sexual act. Event-driven PrEP is where oral PrEP is to be used when an isolated sexual act is anticipated, whereby you hadn't planned for it, but it's there. So that's why the male individual is required now to take the PrEP around 2 hours prior, but it's mostly encouraged 24 hours prior. On to the next slide. I'm going swiftly because of time. The 2-1-1 rule for event-driven pre-exposure prophylaxis, whereby we have the initial dose is 2 pills. Then, for instance, if you are to start taking the PrEP on Wednesday, the first day you'll take the 2 pills. Then on Thursday you take 1 pill, and then on the Friday you were supposed to take another 1 pill, and then now on Saturday, whereby now you will achieve that particular protection. That is what we call the 2-1-1 rule for event-driven exposure. So I'm going swiftly because of time. On to the next slide, whereby we have the PEP. So PEP is basically for emergency situation, that is post-exposure prophylaxis. If it's a planned event, always go for the PrEP. So PEP comes in on emergency situations whereby you didn't anticipate an event and you find yourself, you've been exposed to the virus. Ensure you run to the healthcare provider and they'll provide you with the PEP. So that's how you'll get protected against the transmission of the virus. So the notes will be shared, you'll get to read deeper. On to our next slide. So what antiretroviral medication is used for ARV regimen with preferably 3 drugs is offered. So the drugs also differ according to age and weight. You can see that the PEP, you can take every PEP every time. Can you take PEP every time you have a potential exposure of HIV? The answer is no. PEP should be used only in emergency situations. That is what you should encourage people out there, that instead of getting exposed to the virus and then run to take the PEP, they can actually go for the option of the PrEP, which is most advisable. It's just similar with the contraceptive methods, whereby people are encouraged to go for a certain method instead of opting for the emergency method. So we're gonna look at voluntary medical male circumcision for HIV prevention. On to our next slide. So it is the complete surgical removal of the foreskin. It's a one-time primary prevention intervention that reduces the risk of HIV transmission from women to men by 60%. So we can see actually male circumcision is a very good intervention when it comes to reducing HIV prevention. So how does male circumcision work in preventing HIV? So the foreskin of the penis has many cells that are vulnerable to HIV. So removing the foreskin removes these target cells, and this makes the penile skin more durable, which may also reduce the risk. So medical male circumcision also reduces rate of genital ulcer disease caused by sexual transmission, which can increase HIV risk. That's why we should encourage male circumcision as an intervention. So On to our next slide on mother-to-child transmission of HIV, Katila. So currently referred as perinatal transmission. This is whereby mother-to-child transmission may occur in the uterus or during birth or during breastfeeding. So what you need to encourage pregnant women is to always adhere to ART if they have the infection. And you'll find once you get into the ART therapy, you reduce the viral load, and that's how you reduce the risk of transmitting the disease to your child. So you need to know your status. How can you, next slide, how can you prevent transmitting HIV to your baby? As a pregnant mother, you need to know your status, number one, and then you also need to get into the ART therapy. Yeah, and you need to also encourage your partner to get treated so that once you start the therapy, your partner as well can start the treatment therapy. So on to our next slide on the combination prevention prevent impacts. We are actually finalizing. So prevention intervention must be combined so as to attain proven impact. That is why we should have condom programs whereby we encourage people to utilize condoms, both the male and the female condoms. We have to encourage people to also use pre-exposure prophylaxis as shown above. We have to encourage people as well to go for voluntary medical male circumcision. Also, we need to ensure that needle and syringe programs are adhered to, whereby proper disposal of needles. Treatment to reduce onward transmission. We've seen that once you start the treatment, you can actually reduce the transmission. On to the next slide. We also need to empower women, whereby once the women have been empowered, they can reduce the risk of finding themselves into risky job setups, whereby that they become sex workers and they risk getting infected with the virus. We need to conduct secondary education for girls and young women and girls. We need to conduct community empowerment for sex workers. If you go for sex working adventure, you need to always ensure that you are protected, either using the PrEP and the condom. You can also go for the vaginal ring, etc. And then we also need to implement harm reduction policies. This goes for the various government agencies whereby they come up with those interventions. Then we have combination of HIV prevention. So as defined is a concurrent implementation of multiple interventions to reduce HIV incidence. This can be biomedical intervention, that is the ART and male circumcision, behavioral. There we have the HIV testing, counseling, and condom promotion. CHP, that is effectiveness for HIV control, remain uncertain due to various challenges. But we have seen that it's actually a very good method. When we combine those particular aspects of prevention, we can achieve great impacts. On to the next slide. Fast tracking the end of AIDS, more HIV testing with prompt linkage to care or prevention services, immediate antiretroviral therapy for all HIV infected people for their health to help prevent ongoing transmission. Then we have the pre-exposure prophylaxis and other HIV prevention services for individuals at high risk. So these are the various things that have been happening in efforts to end AIDS. On to the next slide. So as we conclude, now we have learned that the persistent HIV reservoir is the main barrier to curing HIV patients on antiretroviral therapy. So HIV has a particular reservoir in the human body. We didn't get deep into the pathological progression of HIV, but research has shown that the main reason why we don't have a cure for the virus is because we have a very persistent HIV reservoir and the long latency of the HIV. So HIV cure approaches continue to evolve and are increasingly related to similar strategies for diseases such as cancer. So we are continuing to actually come up with various cures, and we have various strategies on the way, and various scientists are coming up with various remedies, as you've seen with PrEP, PEP, vaginal ring, etc. So HIV prevention is a multi-sector responsibility, and each sector must play their roles diligently to achieve positive impact. That goes without say that all sectors must come together. That is the health sector, education sector, and all sectors. And you as an individual, you also need to play a role whereby you need to encourage other people to go for medication, etc, etc. So that comes to the we come to the end of our presentation, and yeah, that is it. I don't know whether we have any questions. We've gone very swiftly because of time, but I think you guys, I don't know whether you've gotten something along the way. We can have maybe comments in the comment section, or any questions if we may have. Katile, or anyone with any inputs? I'm aware that today is on a weekend and people have. Katile, can you get me?
Yes.
Okay. Yeah, I've really rushed because of time. I don't know whether you guys have gotten something.
Ruth is saying she appreciates this session. She has learned a lot.
Okay.
And yeah.
Yeah, thank you so much. Victorine is saying the session was very informative. Thank you, Victorine. Yes, Emmanuel is saying there is more on HIV. Thank you for presentation. Yes, clearly there is so much more on HIV, but basically for this session we were focusing on the SRH aspect of it. We have HIV in relation with TB. We have HIV in relation to so many setups, but because of time we cannot cover everything on HIV. That's why we mainly focused on the prevention interventions and actually an overview of the HIV.
Thank you. Maybe, can you hear me from your end?
Yes, I can hear you, Emmanuel.
Thank you very much for the presentation. I just had an highlight that I made earlier on that
Yeah.
when you talk about U equals to U, that is undetectable equals to untransmittable, this
Yes.
LDL is confirmed after the second or after the repeat VL. That is after the
Yes.
6 months. Of course, you may be virally suppressed, but we tell you to come after another 6 months to ensure that you still LDL for you to practice, U equals to U. Because we've had the
Yeah.
scenarios where we have an individual coming after the 6 months, their viral load is really suppressed, and now they are out there not being responsible, and hence go ahead to transmit to their sexual partner or to their partners. So for good monitoring and close monitoring, we do this after the second VL that is confirmed to be also LDL. Thank you.
Yeah, thank you so much, Emmanuel, for that input. Yeah, that is very correct. Actually, what we are saying that once you start taking the ART, you go for testing at the 6-month onset. But now your healthcare provider is the one who will advise you accordingly. They're going to tell you your viral load is actually suppressed, but they'll give you another time setup whereby you will be told to now come again after another 6 months for another test, so that if they declare you is equal to you, that is when now you can actually proceed with maybe sexual intercourse and what have you. But again, you need to continue to strictly adhere to the ART. Even if you attain that U is equal to U, it doesn't mean you stop taking the ART. It means that you're doing a good job and you should keep it up. Yes, thank you for that input. Any other inputs? Nyambura Kinuthia, thank you so much. She's saying she has learned a lot from this session. Yeah, thank you, Nyambura. Guys, I've really rushed because of time, but I hope you guys have gotten something. And Katila will also share the handout, the notes, so that you get a comprehensive understanding of this matter of HIV. Basically, we've basically just focused on SRH, but as Emmanuel has said, HIV is very broad. We cannot tackle it wholesomely. Yeah. So any other person needs something? Yeah, because of time, I think we need to close the meeting over there. I need someone to volunteer and pray for us.
Hello.
Yes, Katila.
Let's pray. Almighty God, we come before the presence this time of the day. We thank you for giving us time that you have learned about HIV from our speaker, Connie Kaimeni. We appreciate you and we honor you for making us alive. We pray that you may give us joy in this life and you may help us share this knowledge with others. Bless us and be with us. In Jesus' name we pray and believe. Have a good night, everyone. Thank you,
Amen.
Connie,
Good
for
night.
that wonderful session.
Thank you so much, Katila. And good night, everyone.